Essentially, we use that electromagnetic coil to generate an electromagnetic field that, when placed on the head, it creates like a current underneath the brain's cortex. So I think about it a little bit like taking your brain to the gym. People will come in for a series of treatments with TMS. And so we're kind of like stimulating this area of the brain day after day, and strengthening these mood networks, or this place in the mood network that seems to be in neuroimaging and EEG studies underactive in depression.
Welcome to This Way Up, the podcast dedicated to supporting parents and caregivers navigating the complex world of mental health. I'm Andrea, and each episode we dive deep into the conversations that matter, exploring the challenges, triumphs, and transformative journeys of those facing mental health struggles within their families. Whether you're here for expert advice, inspiring stories, or just a little boost to get you through the day, we've got you covered. So grab a cup of coffee, kick back, and join us as we find the bright spots in the mental health journey, because we're all climbing our way up together.
Well, welcome back. As you know, one of my biggest goals with this podcast has always been to bring hope to parents, caregivers, and really anyone navigating mental health challenges. And one of our greatest sources of hope right now is the progress that we're seeing in more effective, accessible treatments for mental health conditions. And that's why I am so excited about today's conversation. My guest is Dr. Suzanne Kerns, who is a leading expert in TMS, or Transcranial Magnetic Stimulation. And if you remember, 7 or 8 episodes back, I had a guest on who actually received TMS for his depression, and it was just a game changer for him, changed his life. This is a non-invasive treatment with really very little side effects, and it is helping people that have depression, anxiety, OCD, and PTSD. And researchers are now even exploring its potential for addiction treatment and even pain management. Dr. Kerns will talk to us about how TMS works, why it's so promising, and what families should know. And she does it in a way that's really so easy to understand. So if you've been looking for options or just curious about the future of where mental health treatment is going, this episode is absolutely for you. Well, welcome, Dr. Kerns.
Thank you so much. I'm really, really happy to be here.
Yeah, well, this is a topic I have wanted to speak about for so long. We had a guest on last season who talked about what it was like to be a patient of TMS. And now I am just so excited to share with our audience about what TMS is from a professional standpoint. Mm-hmm. So let's start there. What is TMS? And then we'll get really deep into it.
So TMS is an interventional treatment in psychiatry, and by that I mean it's not a medication, it's a device that we use. It's an electromagnetic coil that is roughly the strength of an MRI, but a lot more focused. And so one version of TMS is called a figure 8 coil. It looks a little bit like kind of Mickey Mouse ears. Another version is called the H coil, and it's built into more of like a helmet thing that goes on someone's head. But essentially, we use that electromagnetic coil to generate an electromagnetic field that then, when placed on the head, it creates like a current in the cortex underneath the brain's cortex underneath the coil. So I think about it a little bit like taking your brain to the gym. People will come in for a series of treatments with TMS. And so we're kind of like stimulating this area of the brain day after day, and strengthening these mood networks, or this place in the mood network that seems to be in neuroimaging and EEG studies underactive in depression.
So it sits on the outside of your head.
It sits on the outside of your head. So it is a non-invasive treatment. I think a lot of times when people hear about TMS, they think their brain automatically goes to electroconvulsive therapy or ECT, which is a treatment that has been around for a long time in psychiatry, like since the late 30s. And it can be a really life-saving treatment for a number of very sick patients, but also like you have to go under anesthesia for that, and there can be memory side effects. And so that's like a pretty intense treatment. TMS, on the other hand, is something that you can drive yourself to. You do not need anesthesia. You sit in something that often looks a lot like a dentist chair. The treatments last anywhere between 3 and 20 minutes, depending on the protocol. And the feeling of that like electromagnetic field pulsing, it's either, it can be anything from kind of like a light tapping to sort of like more of an intense sort of woodpeckery sensation, depending on people's dose requirements. But I have been doing TMS for well over a decade, and I maybe had half a dozen patients like not be able to tolerate the sensation. A lot of times people are telling me like, oh, I don't know, it's not as bad as you made it out to seem. But I kind of like to overwarn people so that
Sure.
they know what they're getting into. It sounds a little like a woodpecker, feels a little bit like a woodpecker tapping away for kind of 3 to 20 minutes. Yeah, but
S-
the benefits of treatment just like vastly outweigh the risks with TMS.
So it's really designed for people that are resistant to medications or other therapies. Is that correct? Or is that, I mean, it's actually designed for anybody
Mm-hmm.
with depression, but it's approved through the FDA for people who are resistant. Is
Yeah.
that correct?
Yes, and actually, the pivotal trials were done with one antidepressant failure, so people that had not responded to one antidepressant.
Wow.
And so, in general, insurance companies will cover it for folks that have not responded to 2 or more medications. And just because of the time commitment with treatment, it's a lot easier to take a medication every day than it is to come in for your series of TMS treatments. So many people prefer to try a medication or two beforehand, but there's nothing that says if someone really doesn't want to take a medication, they're very worried about that TMS wouldn't work for them. Like it definitely works for depression across the spectrum.
Well,
The
I will tell
nice,
you, my daughter, she was medication sensitive, I should say.
mm-hmm,
I mean, it just seemed like any medication that she ever took, it caused some sort of significant side effect for her.
mm-hmm,
And here in California, they don't do TMS on, or it's not approved for anybody who is under the age of 18. The minute she turned 18, I said, we are going to try this. And she gave me a fit about it. I think she was, she was leery of it because nothing else had worked. We had been through so many different medications. We'd been through so many different therapies, different types of therapies. And she just was just adamant that it wasn't going to work. One of her friends had her convinced that her personality was going to change and that they were completely, redoing things in her head. But she acquiesced and she went because I was pretty insistent. And by the end of her treatment, she was a different person. She felt so much better. And it was a lengthy process. I think hers was like 35 days, but it was 3 to 5 minutes of the treatment.
mm-hmm,
Um, but again, it was worth every minute of it. As a matter of fact, she went in for a tune-up and called the doctor herself the next year and said, "You know what? I'm feeling like I might be getting some depression feelings. Can I come back in?" And she did another treatment, and
mm-hmm,
she has just, like I said, her life is completely different today than it was 3,
mm-hmm.
4 years ago.
That's fantastic. And I think that's, the biggest reason why I love doing TMS is because it is just so life changing for so many people. Not that I don't prescribe medications, I definitely do. They're definitely indicated in certain situations. But once someone has not responded to like 3 or 4 medications, or they have a lot of sensitivities to medications, the chances of response and remission with medication treatment alone get pretty low. And so once you hit that kind of third med trial, because the first 2 didn't work, your chance of response in the studies that we know of is kind of roughly like 30%. Remission, so depression going totally away, is like 15%. And that is really where TMS starts to outperform medications, is in people with treatment-resistant depression. And so whether you have tried 3 medications or you have tried 15 medications, it seems like the chance of response remains about, and it varies with the study, but like about 60-65%, remission kind of close to 45-50%. There's newer accelerated studies where they're getting pretty phenomenal response and remission rates, more like what we see with ECT, like response rates in the 80s, remission rates close to in the 70s.
Wow.
Yeah, and so it's really a shame that more people don't know about TMS.
I want to go back to the regions of the brain because you had said something with depression. You had said that part of the brain was underactive. So you were using the magnetic stimulation to stimulate it to make it more active. How I've heard that depression is also, tied to the chemicals in your brain. So are the chemicals responsible for the activation in the brain? And how is this, does it work with the chemicals or does it work just with the brain itself?
So our brain is an electrochemical organ. The neurons talk to each other through electrical impulses, but they're releasing chemicals. So they're releasing monoamine, so things like serotonin, norepinephrine, dopamine, GABA and glutamate. You see changes in nerve growth factors with TMS, so things like BDNF. So it's not just an electrical or just a chemical response. With TMS, I think about it more like if our brain is a very complex network, right? We have these circuits that involve both superficial regions of the brain, like the cortex, but also deeper areas of the brain, like the limbic system, so like amygdala and hippocampus and areas that we can't reach with TMS. The electromagnetic field with TMS, it activates a couple of centimeters into the cortex. And so that area of the brain, the prefrontal cortex, is where we can reach with the coil. It's where we can reach with that TMS field. But there's really neat neuroimaging studies showing that not only are we kind of waking up that underactive area, it also causes downstream effects in the whole network, so that after you treat someone successfully with TMS, that network it looks more like control, like the control group that did not have depression.
Wow. Wow. Now, so then my daughter also suffered from anxiety. And when she was doing TMS, the insurance only approved the depression side of it. However, what we saw was that she felt so much better. I don't know if it was because she could control her anxiety better because she wasn't fighting the depression, or if there was some effect that she was getting from the TMS itself on her anxiety. And is that common?
Yeah, anxiety studies have been kind of all over the place. And to get FDA approval, you really need to have like a big multi-site randomized control trial, which is very expensive. And so because anxiety studies have been sort of small and targeting different areas of the brain, there just isn't like a robust body of literature behind that. However, in patients with depression with anxious features, There have been groups that have gone back and looked at the sort of like pivotal early depression trials that got FDA clearance or FDA approval for just depression. And they looked at the anxiety rating scores and they were like, wow, like people's anxiety really got a whole lot better. And so since that time, TMS has also been FDA approved for depression with anxious features in just the same way that we treat depression without anxiety. So the high frequency pulses or theta burst pulses over the left prefrontal cortex.
So it's a different part of the brain that it's working with.
No, so it's exactly the same actually as the depression as usual treatments. Also seems to really help with anxiety. Interestingly, like in the same vein, because post-traumatic stress disorder patients also have a lot of anxiety. There are several kind of studies out of the VA system where they looked at patients who had both depression and PTSD. And not only did people's depression get a lot better, but their post-traumatic stress disorder symptoms also got a lot better.
Wow.
Mm-hmm.
Okay, I'm going to take a step back just for a minute because I had a thought about depression, and you had said that your brain was underactive. Am I making too far of a leap to say that if you've got anxiety, that part of your brain is overactive?
Yeah, so sometimes different parts are overactive. So even in depression, there can be parts like the prefrontal cortex that are underactive, but then at times other parts that are overactive. In anxiety, sometimes we think about the medial prefrontal cortex as being an overactive area. So people have done a lot of like trying to target there. There's target there for more like depression with anxious features or certain like anxiety conditions. We used to think that the right prefrontal cortex was like overactive in comparison to the left prefrontal cortex. So there was a time when people were using a lot of stimulation over the right side of the brain for anxiety. And that also seems to help with depression with anxious features. But it kind of turns out actually probably both of the prefrontal cortex, both sides of the prefrontal cortex are underactive, and just stimulating either side probably helps with regaining homeostasis in that network.
Wow.
Mm-hmm.
So when people do TMS, is it a single treatment or a single set of treatments, and it helps them forever? My daughter had a tune-up, so I'm guessing no.
Mm-hmm.
But how often do some people, is the norm that people have to
Mm-hmm.
get treatments?
So for standard TMS, where people come in once a day for 36 sessions, that has been around for longer. So we have more data on durability with that. It seems like about 60% of people maintain their response for a year or longer with that treatment. And I have certainly seen people go like 6, 7 years before needing another treatment and calling me again. On the flip side, of the patients who will relapse within the course of a year, so maybe roughly kind of 40%, the silver lining to that cloud is the vast majority of them will respond to another course of treatment. So if TMS did work for you in the past, it will more than likely work for you in the future.
And is there any risk doing it multiple times?
Not that we know of. There doesn't seem to be like an overdoing it with TMS like there is with a medication or with something like ECT. I will say that said, if someone is on the bipolar spectrum, you can overtreat someone into mania because TMS is an unopposed antidepressant treatment. And so bipolar depression, unfortunately, because was never like a big randomized control trial where response with treatment separated from placebo. So like when they tested actual TMS versus fake TMS in patients, that is not an FDA approved indication. And so that often doesn't get covered by insurance. That said, there are kind of meta-analyses, so studies looking kind of like collecting all the data that's available in the medical literature, looking at treating bipolar depression where it does seem like there's a signal there. And also just anecdotally, I know, like, I'm part of a big network of other physicians through the Clinical TMS Society and some of my research in the past. And most people are treating patients with bipolar depression and seeing similar result rates to major like unipolar depression. But you do have to be more careful in that situation. And so if someone does have bipolar depression and we're thinking about TMS as a treatment option for them, I will almost always ask that they be on a mood stabilizer alongside of their treatment, because TMS is not a mood stabilizer, it's an antidepressant, and we don't want to tip that balance the wrong way.
That makes perfect sense. Now, you had told me when we first discussed that you actually studied under the gentleman who kind of discovered TMS or was researching it. What was the
Mm-hmm.
story behind that? Was it always just, hey, we're going to try to figure out how we can, find a treatment for depression by using magnetic stimulation, or how did he
Mm-hmm.
first get into this?
Yeah, the history of TMS is so interesting too. And I feel really lucky. I just serendipitously have been in the right place at the right time to kind of see a lot of this history unfold. But so in the 80s, there was a gentleman named Professor Tony Barker, who lives in the UK, and he created this TMS device more as a research tool to see sort of like nerve conduction. So he was thinking about stimulating the motor cortex and seeing how long that electrical impulse took to get to other areas of the body. And then Dr. Mark George, who's at the Medical University of South Carolina, he is my mentor. He mentors people all over the world. There's like a big network of his prior trainees doing great things in this field. But he just happened to be, and hopefully he'll forgive me if I get this wrong, but at the Royal College of London for his fellowship, when Dr. Barker was showing off this device, and he saw that and he thought, oh my gosh, like, what if we use that not just as a research tool, but also as a clinical tool? And so then throughout the 90s and the early 2000s, he and others took that technology through the NIMH and really worked on turning it into a treatment for depression. But it wasn't an easy road for him, because there was a lot of money for pharmaceutical studies in the 90s and early 2000s, and no one wanted to hear about this like crazy magnet thing. So really, like, kudos to the pioneers of early TMS research, that they saw the value in this and really pushed and put up with a lot of stigma against what they were doing.
Yeah.
But now the whole, like, neuromodulation is the future of psychiatry. Most people would agree that, like, these kind of non-invasive interventions are safer and more effective than a lot of the medications that we use.
Well, it just seems like TMS it just lasts longer, and it has maybe a deeper effect, I guess. I don't know, but
a more durable effect. It's definitely one of the most durable treatments that we have in psychiatry. And so you're right. Like, I don't want to totally poo-poo medications. I definitely
no, because
prescribe them.
yeah.
But when you stop, you're right. When you stop a medication, you have withdrawal symptoms, and sometimes people are successful in stopping medications when they've got all the other parts of their life dialed in, like they have a good support network, they're
Right.
eating healthy, they're exercising. But sometimes, more often when people stop a medication, they notice it, they start feeling depressed again. Versus TMS is definitely more of a, that's why I think about it like an interventional treatment. So you come in, you do your series of treatments, and if it is helpful for you, it's good for a while.
Yeah.
because it is, I'm going to use a buzzword that I think a lot of people know, it's like stimulating neuroplasticity. And so when we activate these neurons underneath the coil, neurons that fire together, they wire together. We're strengthening that healthier mood network in a way that like medications do not do.
You bring up a good point, though, when you had said that we don't want to poo-poo, as you said, medications, because medications can be a lifesaver for so many.
Mm-hmm.
And TMS, it doesn't work for everybody, right?
Mm-hmm. Exactly. Yep.
So what is what's the percent of success rate approximately for TMS patients?
So, yeah, so it kind of varies depending on the study, but I would say it's, and what I have, the literature also reflects what I've seen in my clinics, that of roughly about kind of like 60 to 65% of people get better with TMS
Okay, that's
for
still,
depression.
it's worth a shot in my mind. It's worth
Mm-hmm.
a shot.
Yeah, especially because it's so low risk. Like there aren't any cognitive side effects. There aren't any upset tummies. There's no sexual side effects. It's not the most comfortable thing in the world. Again, like that tapping is not the best, but most people tolerate it just fine. Sometimes people can have a mild to moderate headache afterwards. It's usually like the first couple of treatments or the first week or so of treatment, and then your brain kind of gets used to the sensation. And there are studies looking at that, sort of like the pain tolerance or discomfort tolerance with TMS, showing that even within one session, pain ratings go down by about 30%. And then with subsequent treatments, they continue to decrease. And so that's what I usually tell folks that are like really struggling with their first treatment with TMS, that it does get better over time. I know it's really hard to believe today, but like in a week, you might be like falling asleep in the chair and I'm poking you to wake up.
It's like working out, right? When you go to the gym for the very first time and it's
Mm-hmm.
hard and then you're sore. And then as you continue to work out the bicep or the muscles, then eventually it gets easier unless you obviously increase it, then it gets harder
Mm-hmm.
again. But
Yeah, yeah.
my
And I think
daughter, who's
most,
fairly sensitive,
mhm.
she didn't feel uncomfortable at all. She said it just felt like I don't know, almost like a little, not a prick, like, but it was maybe just a little tap, but she's
Mm-hmm.
kind of sensitive. And she
Mm-hmm.
was fine with it.
That's great. Yeah. And it does too depend on people's dose requirements. And so
Okay.
TMS is individually dosed to everyone. So you may remember if you saw her first treatment, the way that we can figure out what dose of TMS to use is based on how excitable your brain is. And the
Mm.
easiest marker of brain excitability is to get a motor response with the treatment. So
Oh, I remember that.
yeah, so we put the coil over the spot on your motor cortex that controls thumb and finger activity, and the amount of energy that it takes to just elicit a response about half the time, that's called your motor threshold. And then your TMS dose is based on that. We go slightly higher because most people have a little bit more space between their brain and their skull, where the prefrontal cortex is compared to the motor cortex. So that's why most people
Mm.
tend to treat at like 120% of that motor threshold dose.
So if I remember correctly, it was almost like the response you get when the doctor hits your under your knee, like your kneecap area, and your leg kind of goes out. I remember she was like, "Mom, I'm not even moving my fingers," and they were
Mm-hmm.
moving. And
Mm-hmm.
she thought that was the coolest thing ever. Was she was like, "Look at that!" And then she
Yes.
got a little freaked out. She's like, "Okay, that's weird."
Yeah, yeah. And so some people have a very low motor threshold and treatment feels like almost nothing to them. And other people have very high motor thresholds and it can be a little bit more difficult.
Sure.
But again, like the vast majority of patients are able to tolerate treatments. And we do have kind of tricks up our sleeve as far as adjusting the coil, sometimes changing around medications actually, because there are some medications that will raise those dosing requirements and others that lower them.
Oh.
So sometimes you can do that. Sometimes people will use topical lidocaine, so like a numbing
Oh.
cream on the scalp, especially with those figure 8 coils that are a little bit more focal. Um, uh, yeah, so there are definitely tricks, or just like starting the treatment at a slightly lower dose and kind of working up to your treatment dose over time. That's pretty common practice.
Now, is it only good for depression and depression with, did you call it anxiety features or anxious features?
Depression with anxious features. It is FDA approved for those indications. I know you mentioned that your daughter had to wait until she was 18, but actually TMS has been FDA approved now within the past year or so for adolescent depression. So patients who are 15 and up.
Oh, that's fantastic. Yeah,
Yep.
she was 18 a few years ago. So that's actually
hmm
fantastic. Oh my gosh, I
hmm
wish we would have had that. So,
Yeah.
but it's not, I thought I read somewhere that it was good for OCD as well. Is it not?
Yep, it's also FDA approved for OCD and on specific devices. And so I know we kind of talked about there being two different coil designs. The coil that got the initial FDA approval for OCD was the H coil. So sometimes people call that deep TMS or the company's brain sway. So they ran the initial studies that got FDA approval. Their coil targets, instead of the left prefrontal cortex, like for depression, it targets more medial prefrontal cortex, anterior cingulate cortex. And the protocol with OCD is a little bit different than depression. So depression, you kind of go in, no one knows if like what you do in the chair really matters. It might. With OCD, there is symptom provocation before each treatment, kind of priming that network. Before you do the TMS. And so the how that looks is people come up with sort of a hierarchy of what makes them uncomfortable. And then let's say they have a lot of like obsessions and compulsions around contamination. So like getting like germs and bad things happening. And so you might do something like, well, imagine touching a toilet a couple minutes before their TMS session, something that gets them to like a moderate anxious range, not too intense, but so that they're like thinking about their obsessions. And then you do the TMS. And it seems that pairing that like therapy with the TMS is more effective than doing either one on its own.
That's fascinating.
Mm-hmm.
See, I should have gotten into this a long time ago. It's
Yeah,
so
yeah.
interesting to me. Now,
Mm-hmm.
if we've got somebody who is now saying, you know what, I want to try this, um, what's a good way for somebody to find a qualified practitioner in their area?
Mm-hmm. So I am the treasurer this year of the Clinical TMS Society. That's a organization that I've been involved with since 2016, and I can't plug them enough. I think they have done a ton for the field of TMS. They do patient advocacy. They work with insurance companies. They put on trainings for clinicians. They put on a great annual meeting every year for physicians, and they have a like find a doc feature on their website. So that would be a really great place to look for a TMS physician. It would just tell you that it's like someone who is interested in ongoing education and active in the field. And otherwise, a couple of the device manufacturers have a find a doc feature on their website. I think BrainsWay does. I think Neurostar does too.
So, do doctors then they need to be certified in this in order to do or trained in it in order to do it, right? They just can't decide one day that they're going to be a TMS provider.
So, for better or worse, there isn't really a standard certification for TMS across the country. If a physician bought a device, they could get the device manufacturer's training, which is usually sort of a day, and call it a day. Um,
Mm.
when you're looking for a physician or psychiatrist to do TMS, I would say look for someone who has done maybe a more comprehensive course. Duke University puts on a course, MUSC puts on a course, Harvard puts on a course, the Clinical TMS Society puts on a Pulses course a couple times a year. And then there are a handful of people like me that have done a neuromodulation fellowship where we have done a whole year of different brain stimulation training. And so, but not everyone does that. Not everyone has time for that. If you made that the benchmark of being a TMS practitioner, we would really lose accessibility to a life-saving treatment. But yeah, I think making sure that your TMS practitioner has done more than just the device training.
Yeah, that makes sense. That makes sense. Anything else you think is important to talk about regarding TMS?
Ooh, let's see. So we talked about the one-day protocols, which have been around the longest. That's the way TMS was originally FDA approved in 2008. More recently, because that just isn't feasible for a lot of people coming into the clinic, even though a lot of the treatments are pretty short these days, coming in once a day just is not feasible for most people, especially people that have to drive a couple hours to their nearest clinic. Like most recently, before opening my own practice, I worked at the VA in the VA system, and a lot of veterans have to drive several hours to the TMS clinic to get treatment. And so seeing that need, groups started to look at accelerated treatment. And what that means is packing basically all the treatments into 1 week or over a couple of days. Which is a lot more feasible for people who have busy lives, who have kids, who work full time. So my friend Nolan Williams, also from MUSC, but who's now at Stanford, and his lab, they came up with a protocol that is 10 sessions a day over 5 days. And that got FDA approval, but only for a specific device. So it's this proprietary device by Magnus Medical, which not every psychiatrist obviously has. And they use some pretty fancy neuroimaging with their treatment protocol, which may help with response rates a little bit, but no one is actually quite sure if that outperforms treatment as usual. So the way that we kind of typically map for TMS does not use fMRIs. We use more of a measurement-based system. So a lot of folks in the community, physicians in the community, have taken that protocol without neuroimaging and started doing accelerated protocols in their practices. There have been a couple of small studies since using these 5 to 10 sessions a day over 5 days protocol pilot studies, which also are showing similar results, which is really fantastic. So the Deep TMS company, the Brainsway company, they have a preprint. So they have not published this data yet, but they did 5 sessions a day over 5 days and saw pretty similar response and remission rates to that other accelerated study.
Can you
And so that
imagine
really,
living with depression for so many years, and then within 5 days, you're feeling immensely better? You're feeling fantastic. That would be like
phenomenal.
phenomenal. That's unbelievable.
Yeah. And so because largely because insurance doesn't cover it, it's not
Mhm.
super accessible or affordable for most
Yeah.
people. But it does seem to be, in all the studies that I have seen, as effective as treatment as usual. It's something that I offer to patients. It's something that most psychiatrists who do TMS will offer to patients. And so that really increases access so much to care.
And it doesn't mean that it's not going to be approved by insurance one day.
One day.
If it,
Yep.
yeah, one
Yes.
day.
This field moves very quickly. The landscape of psychiatry between now and when I was a trainee is so different. And really, I can't say enough just how surprised I get that other physicians don't know about TMS, that therapists don't know about TMS, that other psychiatrists don't really know about TMS. I feel so lucky to have trained in the places that I did and have had like access to this treatment and knowledge about this treatment. But it, yeah, always surprises me that more people don't know about it. And so thank you for doing this podcast, because I
Yeah.
think the more word gets out, the more people will start thinking about this, asking about this as a treatment option.
Well, I tell you what, I think I have a big megaphone, and anybody who's around me is probably really tired of me talking about TMS because I just like, you don't
Mm-hmm.
understand. It's
Mm-hmm.
fantastic.
Mm-hmm.
Um, One last thing, the future of TMS. Do you
Mm-hmm.
think it will be able to be used for other um, diagnoses other than depression or depression with anxious features, or OCD, I
Mm-hmm.
guess, too?
Or OCD, yeah. So it's actually also approved for smoking cessation, although not widely covered by insurance. And so a lot of either don't have the capability to treat with that. Or like kind of knowledge about that, but that is one. So I think the future of TMS lies within the addiction space.
Mm.
There's a lot of like really promising addictions literature, the pain space. There's a lot of really promising pain literature.
Mm.
With TMS, and then post-stroke rehab, that's another big spot. And then PTSD, as I said, like we see these response and remission rates for PTSD in patients who have comorbid depression. And so, yeah, hopefully that will be an area where TMS is used, because we also don't really have great medications for PTSD. One thing I'm thinking about we didn't talk about was who TMS may not be a good fit for. In depression, that would be patients who also have an active substance abuse disorder, like especially alcohol use disorder or stimulant use disorder, because those things can really increase the seizure risk with TMS. And so, not that those patients can never have TMS, but they really need to have their substance use under control before they think about TMS for their depression. Another safety no would be anyone with ferromagnetic metal implanted in the head or neck. And so sometimes that can even be like metallic tattoos. So people need to look out for that stuff.
Wow.
Traditional dental work is okay. Yeah, let's see what else. Cochlear implants or any other kind of like implants in the
Mm.
head. Those kind of things would be safety risks and no-nos with TMS. But otherwise, it's a really safe treatment and very effective treatment for the indications it's studied for, like treatment-resistant depression, OCD, smoking cessation.
Okay. Total side note. I didn't even know they had metallic tattoos.
Yes. Yeah, sometimes you have to ask people about that because it could potentially heat up with treatment.
No way. Wow.
Mm-hmm.
Okay. I'm feeling my age that I don't know about metallic tattoos. Now I'm going to go research it so I can figure it out. But it could heat up. That's
Yeah. Or
insane.
like in the VA system, you have to ask about shrapnel.
Oh,
Or
sure.
if you have somebody who's a metal worker, sometimes they can get shards of stuff. So you just have to
Wow.
be careful about metal in the head or neck. That's the biggest thing.
But can you wear
Also,
earrings?
you can wear earrings. Yep.
Okay.
Those are okay. They're really far enough away from the coil. The electromagnetic field degrades so rapidly, like after a couple of centimeters. So we can activate that part of the brain, but it's not really like affecting anything. We used to say 30 centimeters. Honestly, it's probably more like 10 centimeters. But for safety reasons, we make sure
Sure.
there's nothing ferromagnetic within 30 centimeters of the coil. Mm-hmm. If someone has a active seizure disorder, that could also be very unsafe. So if somebody had like a one-time childhood seizure or like one-time seizure because of a medication sort of thing that happened a couple of years ago, those patients, like your doctor needs to know about it. But often those patients can safely get treated with TMS. But if someone like legitimately has epilepsy, TMS may not be the best treatment for them, and we think about other options.
This would be the reason that you would want to look for a provider that has
a little bit more intense training, is to make sure that
Yes,
they're
yeah,
covering all the
someone who's
bases.
doing an accurate safety screen beforehand. Yeah, and I think really someone who knows mental health. So if TMS isn't a good fit, they're
Yeah.
able to think about alternative options for you.
Wow. Well, Dr. Kerns, this was so fascinating. And thank you for taking it and pushing it forward and then coming on today. I really, really appreciate it.
Yeah, you're so welcome. Thank you so much for having me on.
Thanks for tuning in to This Way Up. I hope you're feeling a little lighter, a little brighter, and ready to take on whatever comes next. Remember, the journey of mental health is all about progress, not perfection. So keep climbing. And don't forget to celebrate the small wins. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with someone who could use a little lift.